Hello everyone, welcome back to my channel. Today's topic is about cognitive changes during the menopause transition, the associated risk of dementia, and the guidelines around lifestyle interventions and menopause hormone therapy. Let's explore the facts and what they mean for you. According to research, the prevalence of dementia increases exponentially with age. For those over the age of 65, the prevalence ranges from 0.8% to 6.4%. And it jumps to an astonishing 28.5% by age 90. The World Health Organization estimates that around 15 million people worldwide are living with dementia, and this number is expected to triple by 2050. Alzheimer's disease and vascular dementia are the two major forms of dementia that significantly impact public health. Alzheimer's disease is the most prevalent type, affecting approximately 5 million Americans aged 65 and older. It is characterized by the accumulation of amyloid plaques and tau tangles in the brain, leading to neuron damage and cognitive decline. The disease progresses over time, resulting in severe memory loss, confusion, and ultimately complete dependence on caregivers. Vascular dementia, on the other hand, arises from vascular injuries or diseases in the brain, often linked to stroke and other cardiovascular risk factors like hypertension and diabetes. Symptoms of vascular dementia can include difficulties with organization, attention, and problem solving, often distinguishing it from Alzheimer's, where memory loss is more prominent. Both conditions can coexist, complicating diagnosis and treatment. Mixed dementia, which involves features of both Alzheimer's dementia and vascular dementia, is common in older adults. Dementia differs from age-related cognitive decline, as the latter involves a normal slowing of thinking and memory without significant impairment, while dementia leads to disabling cognitive loss. Although dementia is more prevalent among older adults, it is not an inevitable consequence of aging, with many individuals remaining dementia-free into their 90s and beyond. A 2020 systematic review and meta-analysis examined dementia prevalence across Asia, Africa, South America, Europe, and North America among individuals aged 50 and over in the community. The prevalence rates per 10,000 people were 697 cases for all-cause dementia, 324 cases for Alzheimer's disease, and 116 cases for vascular dementia. The number of people living with dementia doubles approximately every 5 years. Dementia prevalence was found to be greater in women than men, 788 versus 561 cases per 10,000 persons. Amongst those aged 60 to 69, the prevalence of Alzheimer's disease in women was 1.9 times greater than in men, while vascular dementia prevalence was 1.8 times higher in men compared to women. Additionally, the prevalence rates of dementia was higher in Europe and North America compared to Asia, Africa, and South America. Where was I? A longitudinal study looking at cognitive profiles of perimenopausal women found that about 20% of women experience significant impairment in verbal learning and memory. The study also highlights that cognitive decline is more pronounced in women with vasomotor symptoms, depression, sleep difficulties, lower education, and socioeconomic status, emphasizing the role of hormones and lifestyle factors play in cognitive health. Just to be clear, cognitive changes in menopause does not cause dementia, and the large majority of women do not develop dementia. During menopause, many women report cognitive difficulties, often referred to as brain fog. Menopause brain fog symptoms often include challenges with memory and attention, such as difficulty in encoding and recalling words, names, and numbers, as well as problems maintaining a coherent train of thought. Women may also experience distractibility, forgetfulness regarding intentions like why they entered a particular room, and struggles between switching tasks. These changes are generally mild and do not signal the onset of dementia. However, they can be linked to declining levels of estradiol, which significantly affects mood, sleep, and cognitive function. So does this mean replacing estrogen will help? Spoiler alert, the effects of menopause hormone therapy on cognition and dementia risks are complex. Some studies show potential risk, particularly with certain hormone combinations. Others indicate potential benefits. The research is still inconclusive, and it's crucial to consult with a healthcare provider regarding your best options. MHT is effective in alleviating moderate to severe vasomotor symptoms, which are linked to poorer memory performance. However, there is a lack of large-scale clinical trials specifically investigating the impact of MHT on cognition in women experiencing bothersome vasomotor symptoms. Additionally, no extensive studies have been conducted on the effects of MHT or oral contraceptive on cognitive function during perimenopause, a phase where memory changes typically begin to occur. It's crucial to note that existing guidelines regarding MHT for cognitive concerns are primarily based on research involving postmenopausal women who exhibit minimal menopause symptoms, and the potential cognitive benefits of hormone therapy for women with these symptoms remain unsupported by definitive clinical trials. In 4 significant clinical trials, the effects of MHT on cognitive performance in postmenopausal women were found to be neutral, regardless of the timing since the last menstrual period, formulation, method of administration, or progestogen use. For older postmenopausal women, conjugated equine estrogen and medroxyprogesterone acetate was associated with negative cognitive effects, while oral estradiol and vaginal progesterone showed neutral outcomes. The black box warning regarding the risk of dementia with hormone therapy stems from findings in the Women's Health Initiative, which indicated that a doubling of the risk for all-cause dementia in women over 65 who received CEE-MPA. As a result, no major medical society recommends hormone therapy for addressing cognitive issues or preventing future cognitive decline or late-onset dementia. Now let's talk about what you can do potentially to reduce the risk of dementia. It is estimated that 40% of dementia worldwide are due to modifiable risk factors. Here are several modifiable lifestyle factors. Number 1, regular physical activity. Physical activity has been shown to improve cognitive function and reduce symptoms of brain fog. Aim for at least 150 minutes of moderate aerobic activity or equivalent each week. Additionally, resistance training 2 to 3 times a week for 3 to 6 months has also been shown to improve cognitive function. Follow the MIND diet. The traditional Mediterranean diet is characterized by whole, minimally processed plant foods such as grains, legumes, vegetables, fruits, nuts, and fish, complemented by limited amounts of meat, dairy, and moderate alcohol consumption. Similarly, the DASH diet focuses on fruits, vegetables, and low-fat dairy, incorporating whole grains, poultry, fish, and nuts, while reducing fats, red meat, sweets, and sugary drinks. The MIND diet is a fusion of these 2 diets, prioritizing plant-based foods with particular emphasis on increasing the intake of berries and leafy greens, while limiting animal products and high saturated fats. The MIND diet comprises 15 components, 10 brain-healthy foods including green leafy vegetables, nuts, berries, beans, whole grains, fish, poultry, olive oil, and wine, and 5 less healthy options, red meat, butter, cheese, pastry, and fried foods. Daily guidelines suggest at least 3 servings of whole grains, a salad and another vegetable, a glass of red wine, along with regular consumption of nuts and beans. Research indicates that adherence to the MIND diet can significantly lower the risk of Alzheimer's disease, with reductions of up to 53% for strict followers and approximately 35% for moderate adherence. A recent review in 2024 indicated that the benefits may be population-specific for North Americans. As an example, the Nordic dietary pattern was more protective for brain health in the Swedish population versus the MIND diet. Studies outside North America, such as the French cohort, modified the berry intake to total polyphenol consumption. The Chinese cohorts developed the Chinese MIND diet, which replaced wine with tea consumption, olive oil with vegetable oil, and staple foods that included mushroom, garlic extract, and algae. Exposure to particulate matter appears to negatively affect brain aging in women and may be a potential modifiable risk factor. Maintaining a healthy body mass index or BMI within the range of 18.5 to 25. Challenge your brain with mental exercises. Engage in activities that stimulate your brain, such as puzzles, learning a new language, or playing a musical instrument. This can enhance cognitive function and memory. Stay organized. Use tools for memory aids. Keep a diary, make lists, and use calendars or reminders to help manage daily tasks and reduce forgetfulness. Prioritize sleep. Aim for 7 to 9 hours of quality sleep per night. Poor sleep can exacerbate brain fog, so consider establishing a calming bedtime routine and reducing caffeine intake, especially in the afternoon. If you want to learn more about sleep habits, watch this video. Avoid smoking and limit alcohol. Heavy drinking, high levels of homocysteine in the blood, and psychological stress are associated with increased dementia risk. Maintaining social connections is vital. Social isolation and loneliness can increase the risk of cognitive decline, so fostering social relationships is an essential aspect of dementia prevention. Health management. Addressing conditions such as hypertension, diabetes, and depression is critical. Heart health is brain health. A systolic blood pressure of greater than 130 millimeters of mercury at midlife is associated with a 34% increased risk of cognitive dysfunction and dementia. Aim for a blood pressure of 120/80 to prevent cognitive impairment. So care for your heart to care for your brain. The 2024 Lancet Commission added addressing visual impairment and treating high LDL cholesterol from midlife as prevention goals to reduce dementia. For every one risk factor, dementia risk increased by 20%. For 2 risk factors, 65%, and 3 risk factors, 200%. If brain fog worsens, it's important to discuss these symptoms with a healthcare professional, as they may be linked to other underlying conditions or require specific interventions. To wrap up, cognitive changes during menopause are common, and usually it's mild and transient, as it resolves after menopause in most. Understanding the modifiable risk factors associated with dementia and taking proactive steps can greatly enhance your quality of life and prevent disease. Next week, I'll be delving into the supplements that have undergone randomized clinical trials for brain and cognitive performance. So make sure you click the alert button for this episode. Thank you for tuning in. Don't forget to like, subscribe, and share this video with anyone who might benefit from this information. Stay healthy, come walk the talk with the doc, and see you next time.